Question 1. During an emergency response where multiple areas are impacted, a hospital receives an influx of patients requiring immediate care. A patient with a critical but non-life-threatening condition is asked to wait while another patient with a life-threatening emergency is treated first. However, another patient with an unstable condition is transferred to another facility without a full medical screening examination. Under the Emergency Medical Treatment and Labor Act, IMTOLA, which of the following best describes the hospital's legal obligations? A. The hospital was compliant because triaging patients based on severity is standard emergency care practice. B. The hospital violated IMTOLA because the transferred patient did not receive full medical screening examination before transfer. C. The hospital was compliant as long as it provided minimal stabilization before transfer. D. The hospital violated IMTOLA by not treating all patients in the order of their arrival. Answer: B. The hospital violated IMTOLA because the transferred patient did not receive a full medical screening examination before transfer. Explanation: IMTOLA requires hospitals to provide a medical screening examination (MSE) to all patients who come to the emergency department regardless of their ability to pay. If an emergency medical condition is identified, the hospital must either stabilize the patient before transfer the patient properly according to IMTOLA's requirements. YA is incorrect. What triage is an accepted medical practice. IMTOLA requires full MSE before transfer, which was not done in this case. YC is incorrect. Merely providing minimal stabilization before transfer is not enough. IMTOLA mandates either full stabilization or legally compliant transfer. YD is incorrect. IMTOLA does not require treatment in arrival, but it does require non-discriminatory screening and stabilization. Under 42 U.S.C. SS 1395, if hospital transfers patient without following these procedures, it risks civil monetary penalties and potential exclusion from Medicare funding. Question 2. In a situation where formal requirements conflict with patient autonomy, a mentally competent, terminally ill patient expresses a desire to discontinue life-sustaining treatment, including mechanical ventilation. However, the Hospital Ethics Committee argues that withdrawing life support would violate the hospital's duty to preserve life. Which legal principle is most relevant in resolving this dispute? A. The hospital's duty to provide life-saving treatment overrides patient preferences, as healthcare providers must act in the best interests of patients. B. The principle of substituted judgment applies, and the Ethics Committee should make decisions on behalf of the patient. C. The patient's right to refuse treatment under the Due Process Clause of the 14th Amendment supports their decision to discontinue life-sustaining treatment. D. The False Claims Act (FCA) requires hospitals to continue treating patients receiving federal health care benefits. Answer: C. The patient's right to refuse treatment under the Due Process Clause of the 14th Amendment supports their decision to discontinue life-sustaining treatment. Explanation: mentally competent adult has constitutional right to refuse medical treatment even if doing so results in death. This right is grounded in the Due Process Clause of the 14th Amendment as established in cases like Cruz and v. Director, Missouri Department of Health 990. YA is incorrect. Healthcare providers have an ethical obligation to preserve life but must also respect patient autonomy. The right to refuse treatment outweighs hospitals' duty to preserve life in cases where patient is competent and informed. YB is incorrect. Substituted judgment applies only when patient lacks decision-making capacity. In this case, the patient is competent and capable of making their own medical choices. Y is incorrect. The False Claims Act (FCA) relates to fraudulent healthcare billing, not medical decision-making or patient rights. Under federal law and most state laws, hospitals must honor advance directives and patient refusals of care, provided the patient is mentally competent and has made an informed decision. Question 3. While analyzing the root causes of sequential problems in healthcare billing fraud, a compliance officer discovers that a physician practice is receiving direct financial incentives from a diagnostic imaging center in exchange for patient referrals. Which of the following laws is most applicable in determining whether this arrangement is illegal? A. The Anti-Kickback Statute Acts. B. The Emergency Medical Treatment and Labor Act (EMTOLA). C. The Affordable Care Act (ACAT). D. The Sherman Antitrust Act. Answer: A. The Anti-Kickback Statute Acts. Explanation: the Anti-Kickback Statute Acts 42 U.S.C. SS 1327 B makes it illegal to knowingly and willfully offer, pay, solicit, or receive remuneration in exchange for patient referrals for services that are reimbursed by federal healthcare programs like Medicare or Medicaid. Why? B is incorrect. EMTOLA regulates hospital emergency departments and patient transfers, not financial arrangements between providers. Why? C is incorrect. EACAF focuses on healthcare access and insurance regulations. While it includes some fraud prevention provisions, it does not specifically regulate referral payments. Why? D is incorrect. The Sherman Antitrust Act applies to anti-competitive behavior in markets, not fraudulent healthcare referrals. Under ACTS, both the referring physician and the recipient of kickbacks can face criminal penalties, civil monetary fines, and exclusion from federal healthcare programs. Question 4. In a situation where formal requirements conflict with practical medical needs, a hospital administrator is faced with a dilemma regarding a patient's access to emergency care. Patient arrives at a private hospital's emergency room experiencing severe chest pain. The hospital, which does not accept Medicare and primarily serves privately insured patients, has policy requiring upfront payment before treatment for non-members. The attending believes the patient is experiencing life-threatening heart attack and must receive immediate stabilization. However, hospital administrators insist on following policy, requiring proof of ability to pay before admission. Under federal healthcare laws, how should the hospital proceed? A. The hospital may refuse treatment since it is a private facility and does not participate in federal programs. B. The hospital is required to stabilize the patient before considering payment under EMTALA. C. The hospital may require an upfront deposit as long as it is consistent with its general policies for all patients. D. The hospital should transfer the patient to public facility before providing care if payment is uncertain. Answer: B. The hospital is required to stabilize the patient before considering payment under EMTALA. Explanation: under the Emergency Medical Treatment and Active Labor Act, EMTALA, any hospital with an emergency department that participates in Medicare must provide emergency medical screening and necessary stabilization for any individual, regardless of their ability to pay. The law applies to all patients who arrive at an emergency department seeking care, not just those covered by Medicare. Even though the hospital in this scenario does not accept Medicare, if it operates an emergency department, it still falls under EMTALA jurisdiction. Option is incorrect because EMTALA applies to all hospitals with emergency services, even if they do not accept Medicare patients. Option C is incorrect because requiring upfront payment before stabilization would violate EMTALA. Payment discussions can occur only after emergency stabilization. Option D is incorrect because a hospital may not transfer an unstable patient until they have been stabilized unless they lack the capacity to provide appropriate care. Question 5. During a major transformation where existing methods of patient confidentiality enforcement are being revised, a healthcare system is reconsidering its HIPAA compliance strategy. A multi-location healthcare provider has been found to have insufficient encryption measures for electronically stored patient data. A recent audit revealed that employees at several locations were accessing and sharing patient information without necessary secure controls. The provider argues that patient data is only shared internally between authorized professionals and that encryption is not explicitly required by HIPAA. However, some regulators believe the provider is in violation of HIPAA's security rule. Weighs the best legal argument regarding HIPAA compliance in this scenario. A. HIPAA does not require encryption, so the healthcare provider is not in violation. B. The provider is in violation because the security rule requires reasonable safeguards, which may include encryption. C. Internal sharing of patient information is always acceptable as long as employees are authorized healthcare professionals. D. The provider is only in violation if data breach occurs, since HIPAA enforcement is breach-driven. Answer: B. The provider is in violation because the security rule requires reasonable safeguards, which may include encryption. Explanation: under HIPAA's security rule, covered entities must implement reasonable and appropriate safeguards to protect electronic protected health information (FI). While encryption is not explicitly mandated, it is considered an addressable requirement, meaning that if provider chooses not to use encryption, they must implement alternative equivalent safeguards. In this case, the lack of security controls and unauthorized access across multiple locations suggests that the provider has not met the standard of reasonable security. Option is incorrect because although encryption is not mandatory, some form of effective security measure must be implemented. Option C is incorrect because internal sharing must still follow the principle of minimum necessary use under HIPAA. Just because employees are healthcare professionals does not mean they should have unrestricted access to all records. Option D is incorrect because HIPAA compliance violations can occur even without breach if security measures are inadequate. Question 6. In a high-stakes environment where multiple challenges arise during a public health emergency, a state health department is debating the legality of imposing mandatory vaccinations. A new viral outbreak has led to significant hospitalizations and fatalities. The state legislature is considering a law requiring all healthcare workers to receive the new vaccine to continue employment. Some healthcare workers argue that this violates their constitutional rights, particularly under the Due Process Clause and the First Amendment. The state, however, insists that the mandate is necessary to protect the public from a worsening health crisis. Which of the following best represents the constitutional analysis for this case? A. The mandate is unconstitutional because individuals have a fundamental right to refuse medical treatment under the Due Process Clause. B. The mandate is constitutional under the state's police powers to protect public health and safety. C. The mandate violates the First Amendment because individuals may have religious objections to vaccines. D. The mandate is unconstitutional unless the state can prove that no other measure, such as mask mandate, would be equally effective. Answer B. The mandate is constitutional under the state's police powers to protect public health and safety. Explanation. Under Jacobson v. Massachusetts, 1905, the U.S. Supreme Court upheld the state's authority to enforce mandatory vaccinations during public health crisis under its police powers. Courts have consistently recognized that public health measures, including vaccination mandates, are justified when they are rationally related to preventing disease outbreaks. Option is incorrect because while individuals do have some autonomy over medical decisions, this right is not absolute in the context of public health risks. Courts apply rational basis review rather than strict scrutiny to such mandates. Option C is incorrect because while religious objections exist under Employment Division v. Smith, 1990, neutral laws of general applicability do not violate the First Amendment even if they incidentally affect religious practices. Option D is incorrect because courts do not require the government to prove that the mandate is the least restrictive means of achieving its goal, only that it is rationally related to public health protection. Question 7. In a rapidly evolving business environment where companies face increasing legal and ethical responsibilities, an employer must decide how to address concerns about workplace safety. A major construction company has been facing repeated safety violations on its work sites, leading to multiple worker injuries. The Occupational Safety and Health Administration, OSHA, has already issued citations, but the company's management argues that fully complying with regulations would significantly raise costs and reduce efficiency. Group of employees, fearing for their safety, reports the violations to OSHA. The company retaliates by firing those employees. What legal protections do the employees have under OSHA regulations? A. The company can fire employees at will unless they have contract explicitly protecting them from retaliation. B. Employees have protection under OSHA's whistleblower provisions and may file a retaliation complaint. C. The company can require employees to sign liability waiver to avoid legal consequences. D. OSHA can only issue fines for safety violations, but it cannot intervene in employment decisions. Answer. B. Employees have protection under OSHA's whistleblower provisions and may file a retaliation complaint. Explanation. Under Section 11C of the Occupational Safety and Health Act, OSHA employees have the right to report workplace safety violations without fear of retaliation. If an employer retaliates, such as by firing, demoting, or harassing workers for reporting hazards, those employees can file complaint with OSHA's whistleblower program. If OSHA finds merit in the complaint, the employer may be required to reinstate the workers, provide back pay, and take corrective action. Option is incorrect because at will employment does not override legal protections against retaliation. Option C is incorrect because an employer cannot require employees to waive their legal rights to safe workplace. Option D is incorrect because OSHA has authority to enforce both safety regulations and retaliation protections under federal law. Question 8. As businesses expand into digital markets, new challenges emerge regarding consumer data privacy and cybersecurity compliance. A national retail chain collects customer data through its loyalty program, including purchase history, email addresses, and phone numbers. The company recently suffered a data breach that exposed this information. Affected customers are concerned that their personal data could be misused. When questioned, the claims that it is not legally obligated to notify customers of the breach. Under federal law, what are the company's obligations regarding data breaches? A. The company must notify affected customers only if financial data was exposed. B. The company is not legally required to notify customers unless lawsuit is filed. C. The company must follow state data breach notification laws and may face penalties for non-compliance. D. The company can voluntarily notify customers but has no legal obligation to do so. Answer: C. The company must follow state data breach notification laws and may face penalties for non-compliance. Explanation: there is no single federal law governing data breach notifications, but all 50 U.S. states have their own data breach notification laws. These laws typically require businesses to inform consumers when their personal information has been exposed. Many states impose additional requirements, such as notifying state regulators or credit bureaus. Option is incorrect because notification laws apply to various types of personal data, not just financial data. Option B is incorrect because notification is legally required before any lawsuit is filed. Option D is incorrect because companies must notify affected individuals, and failure to do so can result in fines and lawsuits. Question 9. In a high-stakes environment where multiple challenges must be addressed simultaneously, an organization faces a sudden financial shortfall that affects its contractual obligations. A government contractor responsible for delivering critical infrastructure projects unexpectedly faces a severe budget cut. As a result, the company is unable to meet its agreed-upon timelines with several clients, including public agencies. The contractor can delaying deliveries or modifying project specifications to reduce costs, but doing so may violate existing agreements. What are the potential legal and contractual consequences of unilaterally modifying the project scope? A. The contractor can adjust deliverables as needed since the financial situation is beyond its control. B. Unilateral changes could lead to contract breaches, legal disputes, and potential loss of future government contracts. C. The contractor is required to proceed with projects regardless of financial hardship. D. Public agencies are legally required to renegotiate contracts under financial distress scenarios. Answer: B. Unilateral changes could lead to contract breaches, legal disputes, and potential loss of future government contracts. Explanation: government contracts and private agreements are legally binding, and unilateral modifications, changes made without mutual consent, generally constitute a breach of contract. If the contractor modifies project scope without approval, consequences may include financial penalties to meet obligations, legal action from clients seeking damages, debarment from future government contracts due to non-compliance. Option is incorrect because financial hardship does not excuse a contractor from contractual duties. Option C is incorrect because alternative solutions, such as renegotiation or legal arbitration, may be available. Option D is incorrect because public agencies are not obligated to renegotiate contracts solely due to a contractor's financial situation. Question 10. During a critical transition period where existing processes must be restructured to accommodate new regulatory requirements, a company faces compliance challenges. A financial institution is updating its data storage policies to comply with newly enacted consumer privacy laws. Some older records contain personally identifiable information (PI), but are stored in outdated systems that do not support full encryption. The compliance team is concerned about meeting legal deadlines without disrupting daily operations. What steps should the company take to ensure compliance while maintaining business continuity? A. Immediately delete all outdated records to eliminate non-compliance risks. B. Request an extension from regulators while upgrading data protection measures. C. Implement a phased compliance approach, prioritizing high-risk data first. D. Continue using outdated storage until full encryption is possible. Answer: C. Implement a phased compliance approach, prioritizing high-risk data first. Explanation: a phased compliance approach allows the company to meet legal requirements without disrupting operations. Prioritizing high-risk data ensures that the most sensitive information is protected first, reducing liability. Option is incorrect because indiscriminately deleting records could violate record retention laws. Option B is partially valid, but regulators may not always grant extensions, making proactive compliance necessary. Option D is incorrect because continuing to store data in non-compliant systems increases legal and cybersecurity risks. Question 11. While investigating a complicated issue between different departments regarding resource allocation, an organization faces inefficiencies due to conflicting priorities. A multinational corporation has multiple departments that rely on shared resources, such as infrastructure, financial budgets, and personnel. However, each department has different strategic priorities, leading to frequent disputes over resource allocation. Finance team wants to optimize cost efficiency, while the operations team insists on prioritizing speed and reliability, even if it increases expenses. Which approach would be the most effective in resolving this resource allocation conflict? A. Assign full decision-making authority to the finance department, since cost control is the top priority. B. Implement a structured resource allocation framework that balances cost efficiency with operational reliability. C. Allow each department to manage its own resources independently, even if it leads to redundancy. D. Rotate resource allocation control between departments every quarter to ensure fairness. Answer B. Implement a structured resource allocation framework that balances cost efficiency with operational reliability. Explanation. A structured framework ensures that resource allocation decisions are based on clear criteria, such as business impact, risk assessment, and performance metrics. This approach helps to reduce conflicts by creating transparent decision-making processes, align department goals with the company's overall strategy, ensure sustainability by balancing efficiency with operational needs. Option is incorrect because over-prioritizing cost control could compromise service reliability. Option C is incorrect because independent resource management may cause duplication and inefficiencies. Option D is incorrect because frequent rotation of decision-making authority could lead to instability and inconsistency. Question 12. When implementing new protocols in a shared environment, an organization struggles with resistance to change from employees. A hospital introduces a new electronic health records system to improve efficiency and compliance. However, many senior medical staff members prefer using traditional paper-based records and are reluctant to adopt the new system. Some claim that the AIR interface is too complex, while others argue it slows down their workflow. What is the best strategy to encourage adoption of the new system? A. Mandate immediate use of the AIR system without exceptions and penalize non-compliance. B. Provide comprehensive training, gradually phase in the system and incorporate user feedback. C. Allow staff to continue using paper records indefinitely, keeping the old system operational. D. Assign a technology specialist to enter data on behalf of resistant employees. Answer. B. Provide comprehensive training, gradually phase in the system, and incorporate user feedback. Explanation. Change management is crucial when introducing new protocols in a shared environment. A gradual transition with proper training helps employees adapt while minimizing disruptions. Key benefits of this approach include addressing concerns through hands-on support and real-time troubleshooting, improving usability by gathering, implementing user feedback, reducing resistance by demonstrating benefits over time. Option is incorrect because forcing adoption without support can create resentment and reduce compliance. Option C is incorrect because maintaining two systems permanently leads to inefficiencies. Option D is incorrect because outsourcing data entry does not solve the long-term adoption problem. Question 13. In a scenario where efficiency decreases across multiple teams due to inconsistent communication, a company faces project delays. A technology firm is developing a new software product but different teams, engineering, marketing, and customer support, are working with outdated information. Engineers release updates that marketing is unaware of, leading to incorrect promotional materials. Customer support provides outdated troubleshooting advice because they lack real-time access to development updates. Which solution would best improve interdepartmental communication? A. Establish central collaboration platform where updates are shared in real time. B. Require each department to send weekly email updates summarizing their progress. C. Appoint liaison to manually communicate information between teams. D. Allow teams to continue operating independently, trusting that updates will be shared as needed. Answer A. Establish a central collaboration platform where updates are shared in real time. Explanation. A centralized communication system ensures that all teams have instant access to the latest updates, reducing misalignment. Benefits include improved efficiency by minimizing delays caused by outdated information, stronger collaboration across teams through real-time discussions and document sharing, better decision-making by ensuring that stakeholders have accurate data. Option B is incorrect because weekly updates may not be frequent enough for fast-moving projects. Option C is incorrect because a manual liaison introduces bottlenecks and delays. Option D is incorrect because passive communication leads to misunderstandings and inefficiencies. Question 14. During a major transformation where existing methods no longer meet performance expectations, leadership must decide on a new strategic direction. A global logistics company is facing severe delays due to outdated supply chain tracking methods. Competitors have already adopted AI-powered logistics, but implementing such technology requires significant investment and a restructuring of existing processes. Some executives favor incremental improvements, while others argue for a full system overhaul. Which approach would be the most effective for long-term growth? A. Invest in a complete AI-powered logistics overhaul despite initial costs and transition challenges. B. Make small process adjustments without replacing core systems to minimize disruption. C. Continue using the current methods while monitoring competitors before making any decisions. D. Outsource logistics management to third-party providers instead of upgrading internal systems. Answer A. Invest in a complete AI-powered logistics overhaul despite initial costs and transition challenges. Explanation. Major transformations require bold decisions to ensure long-term success. AI-powered logistics systems offer real-time tracking for faster and more accurate deliveries, data-driven decision-making to optimize routes and reduce costs, competitive advantage by keeping pace with industry innovations. Option B is incorrect because incremental changes may not be sufficient to address the root inefficiencies. Option C is incorrect because waiting too long can cause the company to fall further behind. Option D is incorrect because outsourcing reduces control and may not align with long-term strategic goals. Question 15. When developing a solution that must address opposing needs, a business must find a balance between efficiency and customization. A software company is designing an enterprise solution for multiple clients. Some clients need highly customized features, while others prefer a standard version for cost efficiency. Customization increases development time and expenses, whereas a standardized product may not meet all user requirements. The best way to balance these conflicting needs is offer a modular system with customizable add-ons while maintaining a standard core. B. Prioritize standardization to minimize costs and complexity even if customization is sacrificed. C. Develop separate software versions, one fully customizable and one standardized. D. Focus only on the largest clients' requirements and ignore smaller users' needs. Answer A. Offer a modular system with customizable add-ons while maintaining a standard core. Explanation. A modular system provides flexibility and efficiency by maintaining a core framework to ensure stability and cost control, allowing custom add-ons so clients can tailor the software to their needs, reducing long-term development costs by avoiding fully separate versions. Option B is incorrect because a lack of customization can alienate clients with specific needs. Option C is incorrect because managing two separate systems is costly and inefficient. Option D is incorrect because ignoring smaller clients reduces market reach. Question 16. While managing a hybrid approach where timing issues affect performance, a company must coordinate traditional and digital workflows. A retail business is shifting to an e-commerce model while maintaining physical stores. Online orders must be processed alongside in-store sales, but inventory updates are delayed, causing stock discrepancies. This results in overselling online and inventory shortages in stores. What is the best way to synchronize the two sales channels? A. Implement a real-time inventory management system that updates across all sales platforms. B. Separate online and in-store inventories to avoid conflicts even if it increases costs. C. Rely on manual stock checks before processing online orders to prevent errors. D. Limit online sales to only items with surplus stock, reducing the risk of overselling. Answer A. Implement a real-time inventory management system that updates across all sales platforms. Explanation. A real-time inventory system ensures accurate stock levels across all sales channels by automatically syncing updates when an item is purchased online or in store, preventing overselling by showing only available stock, reducing manual errors, and improving customer satisfaction. Option B is incorrect because separate inventories increase operational complexity and costs. Option C is incorrect because manual checks slow down order processing and are prone to mistakes. Option D is incorrect because restricting online sales limits business growth opportunities. Question 17. In an environment where different components must interact seamlessly, integration challenges impact overall efficiency. A hospital is adopting a new patient management system that must integrate with existing medical databases, billing systems, and pharmacy records. However, data inconsistencies and system incompatibilities lead to errors in patient records and delays in processing. What is the best strategy to ensure smooth integration? A. Develop a standardized data format and implement middleware to ensure compatibility. B. Require all departments to manually re-enter data to ensure accuracy. C. Replace all old systems at once with a fully new infrastructure. D. Allow each department to use its own system and manage data separately. Answer A. Develop a standardized data format and implement middleware to ensure compatibility. Explanation: standardizing data and using middleware solutions ensures seamless communication between different systems, reduced data entry errors by automating information flow, cost savings by avoiding a complete system overhaul. Option B is incorrect because manual re-entry is time-consuming and error-prone. Option C is incorrect because replacing all systems at once is costly and risky. Option D is incorrect because isolated systems reduce overall efficiency. Question 18. During an emergency response where multiple areas are impacted, decision-making must be both fast and accurate. A city experiences a cyber attack that disables emergency response communication systems. First responders struggle to coordinate efforts, and hospitals do not receive timely updates about incoming patients. What is the most effective response strategy? A. Activate a backup communication network and establish an emergency command center. B. Instruct all teams to use personal mobile phones for coordination. C. Wait for its specialists to restore systems before taking further action. D. Assign leadership to make decisions independently without collaboration. Answer A. Activate a backup communication network and establish an emergency command center. Explanation: during an emergency, immediate response and coordination are critical. A backup network and command center provide continuity of operations despite system failures, centralized decision-making for better coordination, faster emergency response by ensuring all teams receive updates. Option B is incorrect because personal phones lack security and coordination efficiency. Option C is incorrect because waiting delays critical response efforts. Option D is incorrect because independent decision-making leads to confusion and misalignment. Question 19. When scaling up operations that experience significant inefficiencies, leadership must address bottlenecks while maintaining stability. A technology company rapidly expands its cloud services, but increasing server demand leads to slowdowns and service outages. The team suggests multiple solutions, including upgrading infrastructure, optimizing existing resources, and outsourcing parts of the workload. What is the best approach to operations effectively? A. Upgrade infrastructure to handle increased demand despite high initial costs. B. Optimize existing resources to improve efficiency before making large investments. C. Outsource parts of the workload to third-party cloud providers for flexibility. D. Continue operating with current resources until performance issues become critical. Answer B. Optimize existing resources to improve efficiency before making large investments. Explanation: scaling operations requires a balance between performance and cost. Optimizing existing resources first allows for identifying bottlenecks before costly upgrades, improving software efficiency to maximize current hardware, delaying large investments until necessary, reducing financial risks. Option is incorrect because upgrading too soon may be unnecessary and costly. Option C is incorrect because outsourcing adds dependency risks. Option D is incorrect because waiting too long can lead to system failures. Question 20. While investigating a complicated issue between different departments, conflicting priorities often cause delays. A manufacturing company struggles with delays because the production team prioritizes speed while the quality control team demands thorough testing. Disagreements between the departments slow product releases. How should leadership resolve this conflict? A. Implement a collaborative workflow that balances speed and quality. B. Require the quality control team to prioritize production deadlines. C. Allow the production team to release products faster, reducing testing requirements. D. Keep the departments separate and let them resolve issues independently. Answer A. Implement a collaborative workflow that balances speed and quality. Explanation: effective collaboration between departments ensures streamlined processes that integrate testing without delaying production, mutual understanding of goals to reduce conflicts, higher product quality without compromising efficiency. Option B is incorrect because forcing quality control to rush increases defects. Option C is incorrect because reducing testing leads to long-term failures. Option D is incorrect because separation worsens misalignment. Question 21. During the introduction of new methods where coordination is essential, resistance to change can slow adoption. A hospital introduces a new electronic medical records (EMR) system, but doctors and nurses resist using it due to unfamiliarity and concerns about added workload. What is the best way to ensure successful adoption? A. Provide hands-on training and ongoing support to ease the transition. B. Enforce strict usage policies and penalize those who resist. C. Delay implementation until all staff members are fully comfortable. D. Allow staff to continue using old systems alongside the new one. Answer A. Provide hands-on training and ongoing support to ease the transition. Explanation. Effective change management involves training employees to increase confidence in new methods, addressing concerns with continuous support, phasing implementation to avoid overwhelming users. Option B is incorrect because strict policies create resentment. Option C is incorrect because delaying adoption hinders progress. Option D is incorrect because maintaining two systems causes inefficiencies. Question 22. In a multi-location scenario where consistency requirements must be met, standardizing processes becomes challenging. A restaurant chain wants to ensure uniform food quality across all locations, but variations in local suppliers and staff training cause inconsistencies. What is the best way to standardize quality? A. Develop strict operating procedures and train staff in all locations. B. Allow each location to operate independently based on local conditions. C. Centralize food preparation in one location and distribute meals. D. Use automated systems to replace human decision-making. Answer 8. Develop strict operating procedures and train staff in all locations. Explanation. Standardized procedures ensure consistent food quality regardless of location, efficient training to align employee skills, better control over brand reputation. Option B is incorrect because inconsistent practices reduce quality. Option C is incorrect because centralization reduces freshness. Option D is incorrect because automation cannot replace all human judgment. Question 23. While updating traditional approaches where interconnections are complex, unintended consequences must be managed. A financial institution updates its cybersecurity protocols, but the new measures slow down transaction processing, frustrating customers. How should leadership handle this issue? A. Optimize security settings to balance protection and speed. B. Maintain strict security regardless of transaction delays. C. Roll back updates and continue using old security protocols. D. Allow customers to opt out of security measures. Answer A. Optimize security settings to balance protection and speed. Explanation. Effective cybersecurity requires strong protection against threats, efficient processing to avoid customer dissatisfaction, adjusting policies to maintain both security and usability. Option B is incorrect because delays harm customer experience. Option C is incorrect because outdated security is risky. Option D is incorrect because opt-outs create vulnerabilities. Question 24. During a seamless transition where continuity must be ensured, disruptions can have major consequences. A global company is merging two divisions, requiring unified policies in its systems. Employees worry about workflow interruptions during the transition. What is the best strategy to minimize disruptions? A. Implement changes in phases with contingency plans in place. B. Make all changes at once for a quick transition. C. Maintain separate policies for both divisions indefinitely. D. Rely on employees to adjust on their own. Answer A. Implement changes in phases with contingency plans in place. Explanation. A phased approach reduces risk by testing changes before full rollout, allows adjustment without overwhelming employees, ensures continuity by having backup plans. Option B is incorrect because sudden changes cause chaos. Option C is incorrect because separate policies hinder integration. Option D is incorrect because lack of support increases errors. Question 25. In a situation where resource allocation becomes challenging, prioritization is key. A non-profit organization receives limited funding and must decide how to distribute resources among multiple community projects. What is the best approach to allocation? A. Prioritize projects with the highest long-term impact. B. Distribute funds equally across all projects. C. Focus only on the most urgent projects, ignoring others. D. Rotate funding periodically between projects. Answer A. Prioritize projects with the highest long-term impact. Explanation. Optimal resource allocation ensures sustainable benefits for communities, efficient use of limited funds, long-term improvements rather than short-term fixes. Option B is incorrect because equal distribution ignores priorities. Option C is incorrect because urgent needs may not have lasting impact. Option D is incorrect because rotating funds disrupts progress. Question 26. When developing a solution that must address opposing needs, decision makers must find a compromise that satisfies key stakeholders. A retail company wants to expand its online presence while maintaining strong in-store sales. The e-commerce team pushes for aggressive online discounts, but store managers worry that lower online prices will reduce in-person traffic. How should leadership balance both objectives? Say, offer exclusive promotions for online and in-store customers to maintain balance. B. Prioritize online sales since digital markets are growing. C. Maintain equal pricing across all platforms, regardless of the impact. D. Reduce online promotions to protect in-store traffic. Answer A. Offer exclusive promotions for online and in-store customers to maintain balance. Explanation. A dual-channel strategy ensures that online and in-store sales complement each other rather than compete. Exclusive in-store promotions drive foot traffic, maintaining physical presence. E-commerce growth is supported without undermining traditional retail. Option B is incorrect because prioritizing online sales may hurt brick-and-mortar stores. Option C is incorrect because identical pricing ignores differences in customer behavior. Option D is incorrect because limiting online promotions hinders digital growth. Question 27. During an emergency response where multiple areas are impacted, quick yet coordinated action is necessary. A city experiences a major power outage due to extreme weather. Emergency responders must prioritize restoring power while ensuring public safety and maintaining communication with affected residents. What is the best approach to managing the response? A. Establish a structured emergency plan with clearly defined roles. B. Focus solely on restoring power as quickly as possible. C. Allow different teams to act independently based on their best judgment. D. Wait until the situation stabilizes before deploying response teams. Answer A. Establish a structured emergency plan with clearly defined roles. Explanation. Effective crisis management requires clear leadership and coordination to avoid chaos, simultaneous efforts in restoration, public safety, and communication. Predefined emergency protocols to ensure a swift response. Option B is incorrect because restoring power alone ignores broader safety concerns. Option C is incorrect because independent actions lead to misalignment. Option D is incorrect because delays increase risks for residents. Question 20. While analyzing the root causes of sequential problems in a project, identifying hidden dependencies is crucial. A software development team struggles with missed deadlines, initial delays in coding slowed down testing, which then pushes back deployment. Team leaders suspect that inefficiencies in one phase are cascading into others. What is the best way to address the issue? A. Conduct a dependency analysis to identify bottlenecks. B. Increase deadlines to give teams more time to complete their tasks. C. Assign additional staff to each phase to speed up the process. D. Allow each phase to operate independently to avoid delays stacking up. Answer A. Conduct a dependency analysis to identify bottlenecks. Explanation. Understanding dependencies helps pinpoint the source of delays rather than just addressing symptoms. Optimize workflow by resolving bottlenecks early. Ensure smooth project progression without unnecessary disruptions. Option B is incorrect because increasing deadlines does not fix underlying inefficiencies. Option C is incorrect because adding staff without addressing dependencies may not improve efficiency. Option D is incorrect because isolated phases do not solve interdependent delays. Question 29. In a situation where formal requirements conflict with real-world conditions, adapting policies is necessary. The transportation company mandates that all vehicles follow strict fuel efficiency guidelines. However, real-world traffic conditions and urgent deliveries make it difficult for drivers to always comply. What is the best way to balance policy enforcement with operational needs? A. Just guidelines to consider real-world driving conditions. B. Enforce policies strictly regardless of external factors. C. Ignore efficiency rules when urgent deliveries are required. D. Penalize drivers who fail to meet efficiency targets. Answer A. Just guidelines to consider real-world driving conditions. Explanation. Effective policymaking should Incorporate flexibility for operational realities, encourage efficiency without penalizing necessary adjustments, balance sustainability with service quality to avoid negative trade-offs. Option B is incorrect because rigid enforcement ignores real-world constraints. Option C is incorrect because abandoning rules entirely reduces accountability. Option D is incorrect because penalizing drivers does not address systemic issues. Question 30. When implementing backup procedures across various systems, ensuring reliability is a top priority. A financial institution updates its data backup protocols to protect against cyber threats. The new system requires daily backups, but its staff report failures in some locations, leaving gaps in data protection. How should the company improve backup reliability? A. Implement redundant backup systems with automated monitoring. B. Reduce backup frequency to minimize system failures. C. Assign manual checks to its staff to verify every backup. D. Continue with the current system and address failures as they occur. Answer A. Implement redundant backup systems with automated monitoring. Explanation: reliable backup systems must ensure redundancy to prevent data loss from system failures. Automate monitoring to detect issues proactively. Enhance security without increasing operational burdens. Option B is incorrect because reducing frequency increases data vulnerability. Option C is incorrect because manual checks are inefficient and prone to errors. Option D is incorrect because a reactive approach increases risks.